So planning for retirement includes obtaining appropriate and affordable health care coverage. In that respect, for Americans 65 and older, any conversation about health care must include Medicare. Now, eligibility at age 65 means that health insurance becomes more affordable. Here to talk about this is my guest, John Becker with Exact Benefits in Centennial, Colorado. And John, thanks for joining us. Explain the different parts of Medicare.
Yeah, Medicare can be confusing. In fact, a lot of people get bombarded with mail, phone calls, flyers from insurance companies, from private companies. And so breaking it down is probably the easiest thing to do to help someone looking to get Medicare. So you have Part A, which everyone's going to get, and that's going to cover all the in-hospital stuff. Okay, so it could be home health care, hospice coverage, etc. Part B is going to be outpatient services. So that's doctor visits, x-rays, labs, ambulance services. So those are the two parts you're going to get. You're going to see that on your red, white, and blue card. So anytime you apply for Medicare, you're going to get this fancy card that will have a Part A date and a Part B date. Part C combines Part A and Part B, and in some instances will cover Part D, which is prescriptions. Okay? And that is, most people are going to know this as the Medicare Advantage plans. Part D is a prescription plan. So if you do not get a Part C, which is the Med Advantage plan, you need to purchase a Plan D.
And then what is Medigap?
Yeah, Medigap is just a fancy term for purchasing another health insurance plan that simply covers the costs of what Part A and Part B do not cover. These are private insurance companies, so it could be Aetna, Mutual Omaha, Anthem, et cetera, and a lot of people will either go the Medigap route or they go the Part C route.
So now what if I'm 65, I'm still working with health insurance from my employer, should I still get Medicare?
Such a great question, because unfortunately people are working at 65, which I think is a travesty. However, if they are covered under their current insurance plan or on their spouse's plan, they don't necessarily need to apply for Part B just yet. The analysis that we would encourage people to do would be to look at the costs. What is it costing them to be on that plan? And then compare it to the Part B premium, which is $170.10, and then whether they do a Med Advantage plan, which typically costs $0, or if they in fact choose to do a Medigap plan.
Now, John, talk about the enrollment process.
There's going to be several different periods. Keeping it very simple, if you're turning 65, that's called the initial enrollment period. You have 3 months prior to turning 65 and 3 months after to apply for Medicare. There's going to be special enrollment periods. So we already alluded to one of them, where if you are working at age 65 and you are still covered under your group or your private health insurance, and you eventually decide to enroll in Medicare, that would be a special enrollment period. There's going to be a certain period of time come October through December, which is an annual enrollment period, and that's where everyone's going to get bombarded. I mean, everybody, because that's when insurance companies can advertise. People are calling everyone left and right because you can switch your plans, you can get a plan, whatever it may be. It's a very, very busy time of the year.
And then why is it necessary to work with an advisor who specializes in Medicare?
Every plan is different, and every situation is different. Every family's needs are different. Some people might have more severe health issues than other people, and so really having the ability to research all the plans, not just for having access to the companies, but a lot of plans will help someone if they have diabetes, right? Or some plans have Part B givebacks or whatever it may be. Maybe someone needs hearing aids over anything else. And so to work with someone or an outfit that can truly look out for your interests and make sure they're finding you the right plan, it eliminates all the confusion and all the hassle of Medicare.
That's John Becker in Centennial, Colorado, and this is Retirement News Online. Thank you for watching.